Okay, according to Cherry and Jacob 2014 of your textbook, of all the nurse manager's varied and complex roles, staffing and assigning work is probably the most challenging and certainly the most important to the delivery of safe, quality patient care. Staffing can be defined as activities required to ensure an adequate number and mix of healthcare team members to meet patient needs and provide safe, quality care. And considerations are patients' needs, staff satisfaction, and organizational needs. While this is what staffing is, some get staffing confused with scheduling. Scheduling is simply the act or function of implementing the staffing plan. Staffing, planning for, hiring, and deploying qualified human resources to meet the needs of a group of patients. The number and mix need to be such that patients' needs can be met safely and with quality. Research over the last decade has shown that there are definite links between nursing staffing, workloads, skills mix, and patient outcomes. Adequate staffing reduces medical and medication errors, decreases patient complaints, decreases mortality, improves patient satisfaction, reduces nurse fatigue, which decreases nurse burnout, and improves nurse retention and job satisfaction. This is according to the ANA in 2013. We don't want to turn out like this nurse through nurse burnout. Inadequate staffing leads to nurse burnout. So what can we do about staffing and nurse burnout? There is a nurse, Vanessa, that got involved and spoke at the House Labor Committee advocating to increase staff to patient ratios. To view this, go to the website address that is provided in this transcript. Staffing and patient needs. Research validates contribution of RNs to improve patient outcomes and prevention of premature mortality. Primary considerations for staffing a nursing unit include number of patients, intensity of care required, staff experience and preparation, geography of the environment, and the available technology. So let's talk about the patient classification system. It categorizes patients according to the care needs. This is the acuity level. Higher acuity levels mean that nursing care needs are more intense. The ANA recommends that classification systems should consider patients' age and functional ability, communication skills, cultural and linguistic diversities, severity and urgency of the admitting condition, scheduled procedures, ability to meet healthcare requisites, availability of social supports, and other specific needs that are identified by a patient and the RN. Staff members must have the educational preparation, skill, and experience necessary to meet patient care needs. Concerns about inadequate numbers of appropriately skilled and experienced staff should be addressed with executive level managers. Satisfied nurses generally provide higher quality, more cost-effective care. 24 hours a day, 365 days a year, staffing needs make meeting the nurse's personal needs difficult. Creative staffing options are available to meet varied needs of staff members. Methods to gain staff input about staffing and to enhance autonomy are the key to staff satisfaction. Organizational needs affected by staffing include financial resources, licensing, regulations and accreditation standards, and customer satisfaction. Efficient staff management ensures the organization's financial solvency. Nurse managers are accountable for budgetary guidelines for numbers of staff working at any given time and the staff mix. RNs are the most expensive staff, thus ratios for RNs to other types of care providers may be established. Licensing and accreditation agencies do not impose mandatory staffing ratio, but do look for evidence that patients are adequately cared for. Customer satisfaction is critical to our organization's success. A customer's personal interaction with employees is key to satisfaction. So the nurse manager's number one challenge is to have appropriate staffing within budget constraints with well-trained, competent professional staff members who are committed to providing safe, high-quality care. So let's talk about some nursing care delivery models. These detail how task assignments, responsibilities, and authority are structured to accomplish patient care. They describe which healthcare worker is going to perform what task, who is responsible, and who has the authority to make the decisions. Basic premise is that the number and type of caregivers are closely matched to the patient care needs in a cost-effective manner. Now let's look at the classic nursing care delivery models. First, we have the total patient care we're going to look at. The nurse is responsible for planning, organizing, and performing all patient care during the assigned shift. So kind of a little bit of history on this is it's the oldest method of organizing patient care, and it's sometimes referred to as case nursing. Nursing students typically perform total patient care for assigned patients. Some of the advantages are that the RN maintains a high degree of practice autonomy. The lines of responsibility and accountability are clear. The patient receives holistic, unfragmented care, and communication at shift change is simple and direct. The disadvantage is that the number of RNs that are required is very costly, and some tasks could be accomplished by a caregiver with less training and at a lower cost. The nursing shortage will affect RN availability. Common use areas are such as the intensive care units, post-anesthesia care units, areas like that. Then we have functional nursing. Staff members are assigned to complete certain tasks for a group of patients rather than care for specific patients. Lines of responsibility and accountability include that the RN nurse manager assigns responsibility for completion of tasks to a group of healthcare workers. The RN is responsible for planning care and supervising the workers. The RN retains accountability for the patient care provided. The advantages are that they provide economically and efficiently, the minimum number of RNs required for patient care, and tasks are completed quickly with little confusion about responsibilities. The disadvantages are that it may be fragmented, possibility of overlooking priority patient needs, patient may feel confused because of many different care providers, and caregivers may feel unchallenged when performing repetitive functions. Some of the common use areas are like the operating room. Then we have team nursing. The RN functions as a team leader and coordinates care for a small group of patients. The lines of responsibility and accountability are that the RN team leader is responsible for the following: planning care, assigning duties, directing, supervising, and assisting team members, and giving direct care. RN retains the accountability for all patient care. The RN team leader is responsible for encouraging a cooperative environment and maintaining clear communication. Some of the advantages are that there is high quality, comprehensive care that can be provided with a relatively high proportion of ancillary staff. Each member participates in decision making and problem solving, and each member contributes to his or her own special expertise or skills. The disadvantages include continuity of care may suffer with daily team assignments. The team leader may not have the leadership skills required to effectively direct the team. Insufficient time for care planning and communication leads to unclear goals and fragmented care. Common use areas are effective, efficient method of patient care delivery that has been used in most inpatient and outpatient healthcare settings. Then we have primary nursing. The RN is the primary nurse that assumes a 24-hour responsibility for planning, directing, and evaluating the patient's care from admission through discharge. It provides total patient care while on duty. While off duty, care is provided by an associate nurse who follows the care plan established by the primary nurse. Lines of responsibility and accountability are that the RN, the primary nurse, has 24-hour responsibility and accountability for the patient care. Associate nurses are responsible for following the plan of care. The RN primary nurse is responsible for maintaining clear communication among all members of the healthcare team. So some of the advantages: direct patient care is provided by a small number of nurses, which allows for a high-quality holistic patient care. The patient is able to establish a rapport with the primary nurse, and patient satisfaction is enhanced. Job satisfaction is high because nurses are able to practice with a high degree of autonomy and feel challenged and rewarded. Some of the disadvantages are implementation may be difficult because primary nurse is required to practice with a high degree of responsibility and autonomy. Inadequately prepared primary nurse may not be able to make the necessary clinical decisions or to communicate effectively with the healthcare team. The RN may not be willing to accept 24-hour responsibility as required. The number of RNs required for this method of care may not be cost effective and may be difficult to recruit and train. The common use areas are home health, hospice, or even long-term care. Then we have modular nursing. This is the modification of team nursing. Patient unit is divided into modules. The same team of caregivers are assigned consistently to same geographic location. Each location or module has RN as a team leader. The goal is to increase the involvement of the RN in planning and coordinating care. It is a designated modules that should contain all the supplies needed by the staff to maximize efficiency. Then we have the partnership model or co-primary nursing. The RN is partnered with an LPN or a nursing assistant, and the pair work together consistently. The modification of primary nursing designed to ensure more efficient use of the RN. The lines of responsibility and accountability are that the RN is responsible for planning care, assigning duties, coordinating care, and supervising the partner. The RN is accountable for patient care for all assigned patients. The advantages are that it is the most cost effective than the primary care system. The RN can encourage training and growth of a partner. Disadvantages are that the RN may have difficulty delegating to the partner, or consistent partnerships are difficult to maintain on the basis of varied staff schedules. Then we have patient-centered care. So the definition by the Institute of Medicine in 2001, it is providing care that is respectful of and responsive to individual patient preference, needs, and values, and ensuring that patient values guide all clinical decisions. Nurses, physicians, and other health professionals partner with patients and families to ensure that healthcare decisions respect patients' wants, needs, and preferences. Now I want to talk about the philosophy of patient-centered care. It is not a typical nursing care delivery model, but more a philosophy of care. It should be incorporated as an essential component of any nursing care delivery model. Methods to engage patients, families, and significant others as partners in care involves including them in developing care plans and discharge plans, including them in change of shift or handoff reports, provide them with the information and education needed to make informed decisions, and to establish family advisory councils to engage patients and families in decision making. In order to evaluate potential nursing care delivery models, the following questions need to be answered. Are patient outcomes achieved in a timely, cost-effective manner? Are patients and families happy with care? Are physicians and other health team members satisfied with care? Does the system allow for implementation of the nursing process? Does the system facilitate communication among all members of the healthcare team? Now we're going to discuss nursing now and in the future. Traditional models of nursing care focused on comprehensive knowledge of patient needs and care provided over an extended period. Now nurses may be assigned an entirely new group of patients to care for every shift or even more than once during a shift. Nurses of the future must conduct focused assessments and set priorities to resolve before the patient is quickly transitioned to another level of care. Nurses in outpatient and community-based settings are challenged to address the following: patients' demands for instant access to care and information, and patients' need for support and education to address lifestyle and personal choices that may affect their health. Relationship-based care must be considered in high-tech, fast-paced environments where care must be consistent with nursing values of compassion, caring, and healing. Nurse leaders will be challenged to identify new models that are cost-effective, will improve quality and safety of care, and facilitate relationship-based nursing. This concludes the lesson on staffing. If you have any questions related to course content, contact the instructor.